And it's good to be here today with two doctors who have stood up for their local community and made a real difference to the support of GP after hours service, and also to be joined by Patrick Conroy and also Sharon Clayton as the local members who've been impacted by this cuts. The GP clinic behind us used to be available till 10 o'clock at night. Today it shuts at 4. It shuts at 4 because of the cuts which have been made to something like 1/3 of the hours of GP after hours services. Some 15,000 people who would have received service and support and healthcare through this GP after hours service will miss out as a result of the closure of one of the services and the cutting back in hours of another 4. A federal Labor government will step in to restore funding to remove these cuts. The federal government doesn't really believe in Medicare and doesn't really believe that people should get health care when they need it. It's one of the great divides in Australian politics. Federal Labor will always stand up for Medicare, will always stand up for health care to be available whenever people need it. It's something that's in our DNA. It's something we fought for when we created Medibank. After Medibank was abolished by the incoming coalition government, it's something that we fought for in the creation of Medicare by the Hawke government. It's something as well that we continue to argue for when the current government looked at Medicare co-payments, and it's something that we've resisted with the cutbacks and changes that have been made to the schedule. But to close down services and to reduce services on Christmas Eve is a heartless act by a government in the midst of a pandemic where we know they haven't planned to vaccinate people properly, they haven't planned to have purpose-built quarantine. Now there are problems with the booster shot rollout in terms of supply, and there are problems now as well with people being able to access rapid antigen tests. The truth is that this cut should not have occurred. It certainly shouldn't have occurred on Christmas Eve, and the federal Labor government that I lead will join with Dan and with Pat and with Sharon and with Meryl Swanson in making sure that this is reversed because this healthcare is so important. And I'd ask Annette to make some comments as founding doctor of this service about how important this is for the local community. Thank you.
Thank you very much. Ladies and gentlemen, this is the most wonderful news that we have been listened to, and we now have a potential for the service to be reinstituted at its former strength. It has been an absolute travesty that just when the public has needed us most over this Christmas pandemic period, our services have been cut. The doctors, nurses, receptionists who work in the service are all incredibly disappointed because they know how much the public values our service, how many times we are thanked for being here and being available, especially on public holidays like today. It's have all been so frustrated. So we have to thank the community so far who has expressed their own feelings about losing part of the service, the doctors and nurses and receptionists who have all lobbied as hard as they can. To our local members and potential members, you know, Dan, Pat and Sharon here today, you've all worked, you've listened really hard and you've done everything you could to help us. And now thank you to Mark Butler and Anthony for listening to us and actually doing something about it. We are incredibly grateful for your position, and yeah, thank you.
Thank you very much, and thanks for what you do in the community. I think this is a time where if Australians didn't value health workers beforehand, they certainly do now.